Now, let's do the assessment of the mouth. First, we have to perform hand hygiene or hand washing. And then, gather the equipment, and these are the gloves, gauze pad, pen light, speculum otoscope, and tongue blade or tongue depressor. And then, next is to explain the procedure to the patient. So, ma'am, I will inspect your mouth. And for me to do that, I may need to touch your mouth. Is that okay with you?
Okay po.
And we do this procedure to ensure that everything is normal. And if there are any abnormalities, we can prevent any further complications. Okay?
Okay.
But before we proceed to the proper assessment, I may I will just ask some questions. Is that okay, ma'am?
Okay.
So, ilang beses po kayo nagsisipilyo sa isang araw?
2
2 beses po?
po.
Okay. Tapos, ilang beses po kayong bumabisita sa dentista nyo?
Once in a month po.
Once in a month. Okay. May singaw po ba kayo? Or
Wala po.
sakit po ba yung ngipin nyo?
Wala po.
Okay. First, we have to inspect the lips and observe the lip consistency and color. Ma'am, can you do this? Okay, thank you, ma'am. So, the color of the lips of the patient is dark pink. It is also smooth in texture and without lesion. She also has the ability to pursue lips, and there is no signs of cyanosis, pallor, or blister, which is normal. Next is to inspect the teeth and the mouth. Please open your mouth, ma'am. Okay. Okay, the teeth number are normal. She has 23 teeth and no signs of plaque, tooth decay, or broken teeth. Next is to ask the client to bite down as thought of chewing something and note the 10 alignment of the upper and lower jaw. Okay, next is to put gloves and retract the patient's lip and cheeks to check gums for color and consistency. Okay. Okay. The color of the gums is pink and no retraction of the gum is happening. Next is to inspect and palpate the tongue. So, ma'am, can you ilabas niyo po yung dila niyo? Okay. Ilabas ko pa. I've never been down the hat. Okay, so I can see that the tongue is pink color and it is also moist and slightly rough. And if there are any lesions, we have to palpate it. Next is to assess the ventral surface of the tongue and to inspect the wharton stalks. So the base of the tongue is smooth and prominent. Next is to observe the side of the tongue and palpate for lesions or ulcer or nodules.
Yeah.
And next is to check the strength of the tongue. So, ma'am, okay, pwede pong ituro niyo po. Mag-aka. Okay, at the other side. Okay, thank you. Next is to check the anterior tongue's ability to taste. I will use the tongue depressor. Hila. Ang lasa. Wala. Next is to inspect the hard and soft palate and the uvula. Yeah. Yung dila nyo po, paki-relax po. Ganon. You have to check your uvula. Okay, so the color of the uvula is light pink and the soft palate is lighter than the hard palate. And next is to check the odor of the mouth. Ha. 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 Okay, so I can smell toothpaste, which means the patient has just brushed her teeth and there are no signs of bad smell. Next is to assess the uvula, inspect the tonsils, and inspect the posterior pharyngeal wall. And I will use a pen light and a tongue depressor. Okay, ma'am, please open your mouth. Okay, relax. Can also see the gag reflex of the patient, which is good. So the position of the uvula is on the middle of the soft palate, and the tonsil and the posterior pharyngeal wall is pink in color. It is also smooth and no discharge or lesion. And lastly, before we inspect the nose, we have to discard the gloves and perform hand hygiene or hand washing. Is the nose. First, we have to inspect and palpate the external nose. So I can see that it is symmetrical and straight. It also have no flaring, uniform in color, and not tender. Next is we have to check the patency of the airflow through the nostril. So, ma'am. Okay, sniff. Okay, very good. It is all normal. Next is to inspect the internal nose. I will use a pen light. Okay, the nose have pink mucosal. It also have clear or watery discharge, no lesion, and the nasal septum is attached to the middle. And lastly, is we have to assess the sinuses. First, we have to palpate the frontal and the maxillary sinuses. And okay, it is not tender, which is normal. Next is to percussion the sinuses. Tap, 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 tap. Okay, this also not tender. And do you feel any pain when I'm percussing, ma'am?
No.
Okay. Next is to transluminate the frontal sinuses and the maxillary sinuses. I will just use a pen light because I don't have a strong light. Please open your mouth, ma'am. I don't see any abnormalities and the findings are all normal.